I'd love to say we're surprised, but we're not, because we were seeing it coming, but it's horrendous, right?
There has been a record increase in the number of Quebec doctors who appear to have opted out of the public health system, likely to work in the private sector, with data reportedly revealing an almost 22% jump in general practitioners and specialists who no longer bill the public sector for their work since last year.
What we need is more physicians in the public healthcare system. So it's something that's really scary, I think, for all patients and for a lot of the physicians that stay in the healthcare system right now.
According to the Montreal Gazette, 780 Quebec doctors opted out of public health care as of July 2024, compared to 641 in 2023, as seen on a list compiled by Quebec's Health Insurance Board, the RAMQ, leaving some to call on Quebec to acknowledge the problem and put certain restrictions on private clinics.
I think they really have a free range of doing pretty much whatever they want. If they want to work, a few hours per day, or if they want to charge like huge amount of money to patient, they can do that.
We used to say, a couple of doctors ceasing doing business with RAMQ was marginal. We can see now there's a trend, and my feeling is that it's not going to get better. It might even get a little worse before it gets better.
And Lagacé Dawson, a spokesperson for the Canadian Health Coalition, says this recent trend is a disgrace because it means Quebec patients who need access to physician care will have more difficulty in getting the care they pay for with their taxes. Lagacé Dawson adds that the Quebec government has been extremely lax about allowing doctors to go back and forth between the private and public sectors, and that the government needs to tighten up rules to protect the public health system.
It's a form of double dipping, right? Like in the morning, the physician's in the hospital, in the afternoon, they're in their private clinic, and good luck to you if you need to speak to your specialist in the afternoon.
Dr. Michael Kalin, a Montreal family doctor, suggests fewer doctors would enter the private sector if they had more control over where they could work.
Even though Montreal is missing several hundred physicians, we will not offer jobs to all the doctors who are graduating this year. I don't understand that. No doctor in Montreal understands that. We should give them positions that are attractive to them, and I think that if we do this, everybody benefits.
The more the trend of private clinics taking over accelerates, the less there's going to be resources in the public system. So it could even lead to the crumbling of our public healthcare system, which I think would be terrible.
In Montreal, Gareth Maddock-Jones, City News.